Conservative treatment measures are often very successful in alleviating your pain and symptoms. The cornerstone of treatment for shoulder impingement is physical therapy. Therapy is used to increase your range of motion, increase your strength, and thus decrease your impingement symptoms. Anti-inflammatory medications are an additional measure to reduce pain. Well, they come in two flavors, shots and pills. The pills are non-steroidal anti-inflammatory drugs, while the shots consist of cortisone. Both types of medications reduce the inflammation, but do not take the place of physical therapy. Let's meet with one of our therapists to talk about why therapy is so important and what exercises you can do to help regain your range of motion.
The goals for physical therapy for impingement, the primary goal would be to identify whether the impingement is a structural cause or a functional cause. So during our evaluation, we assess that, and then we determine where the patient is in terms of the impingement process. Primary goals for physical therapy to decrease shoulder pain are, first of all, decrease inflammation. The second goal of physical therapy is to maintain the ability to move the shoulder, not lose motion. That's really key. And then if the patient has too much motion, to try to get them to control that motion through exercises. And that takes us to our last phase, which is the strengthening phase, or the specific phase of getting the patient back to work or activity, and doing that through a broad exercise program. The physical therapy for the shoulder, again, the pain limitation phase starts with just some simple exercises, what we call pendulum exercises, or passive range of motion exercises, what we call table slides. That allows the joint to heal, but not to lose its mobility. The first exercise that we're going to instruct is pendulums. It's a passive exercise to increase the shoulder's range of motion without irritating or causing pain. So you're going to do clockwise and counterclockwise motions with a light weight, go back and forth, and we're going to do 20 of those.
Okay. Forward, back.
Perfect. Nice and easy. And I always tell patients, pretend that that weighs about 100 pounds. So it just pulls on the arm. You're relaxed through the shoulders, minimal arc. And what this is doing is providing a distraction on the shoulder, maintaining motion, increasing circulation. So it's a fantastic exercise for pain and to maintain the range of motion. Rotation exercises, particularly internal rotation, we do what's called a horizontal or pulling the arm across your chest. We also do a sideline rotation exercise to help the patients be able to reach behind their back. And then we actually have them reach behind their back to mimic what they actually have to do to get a jacket on, for instance, or to put their seatbelt on. And then lastly, the home exercise program focuses on function, focuses on the ability to have the strength and the endurance to do all the exercises and to do them without hurting themselves. We always like to tell people that we only see them on the average 3 hours a week, and they need to follow through. The muscles and the joints have to get used to activity. If pain is a limiting factor, they have to do the icing, they have to do the resting, and then consequently, once that stage of the rehab is concluded, then we need to retrain the muscles to do what they need to do. So typically, we like to see patients getting better within 3 or 4 weeks. And then after that, then they can do it at home. The home exercise program really focuses on the main reason why people come to therapy. I think it's easy to treat the symptoms and to take meds or to do ice, but if you don't treat the cause of what's creating those symptoms, then we typically see those patients back again. So we explain to them, we educate them, which is a big part of physical therapy in conjunction with the home exercise program. They need to do these exercises so they don't see us again, so they can be active, so that they can work and then not have to have a recurrence of the shoulder symptoms.
Let's talk about the role of arthroscopic surgery in treating impingement. Remember that in impingement, we had a normal shoulder blade. Ball and socket was normal. Arm was normal. But we had these bone spurs up above. And we had that rotator cuff that had some partial tears and inflammation. And the bursa sac that was also inflamed. With arthroscopic surgery, step one is to remove those bone spurs. This is A, this is C, this is A, this is C. This is your ball and socket. Trim the rotator cuff tendon so it's nice and smooth. And trim the bursa sac so it's back to a more normal size. Again, impingement of the shoulder, and the shoulder after arthroscopic surgery.
Sometimes your symptoms can't be relieved with just physical therapy and anti-inflammatories. If non-surgical treatment doesn't help, then an arthroscopic procedure for your shoulder is considered. Two of the most common surgical procedures are a subacromial decompression and a distal clavicle excision. The main goal of both surgeries is to get rid of any bone spurs and to increase the space between the acromion and humerus so your rotator cuff tendons have room to glide without pinching. After an arthroscopic procedure, participating in physical therapy is important because it helps you regain pain-free range of motion and full strength of your shoulder. The therapy following a shoulder arthroscopy is very similar to the therapy you'd do if you were treating rotator cuff impingement non-surgically.
Here's some tips on preventing rotator cuff impingement syndrome from recurring. First of all, continue to perform the exercises given to you by your therapist. Limit your repetitive overhead motion whenever possible. Stretch your shoulder prior to any sports or physical activity. At Coordinated Health, we work as a team in your treatment and recovery. But remember that you're the most important member of that team. You hold the keys to the success of your own treatment. Your consistent effort during and after treatment build a foundation for maintaining a pain-free shoulder. Take what you learn from us, continue to apply it in your daily life. Spend a few minutes a day to stretch and strengthen your shoulder. This has a tremendous impact preventing pain and loss of function. And that's the art of medicine.